A curbside consult is when somebody asks you for advice outside the normal clinic settings. You're a physio. Oh, what do I do with my arm? Oh, or worse, my friend has this problem. What should I do? We can't let our ego override our judgment. Everyone wants to jump in and help and start providing care. There are two big problems with these curbside consults. And stay to the end because I've got two practical solutions on how to handle them. These curbside consults are also called backdoor referrals or cocktail party referrals or elevator talks. This happens all the time, but you have to know how to handle them. Most people talk to you about their pain. Pain and inflammation needs relative rest, so don't make things worse. Some people have a lack of motion, they're stiff, they need pain-free activity. And some people tell you about a situation and they need something else. This might be direction for them to see a physio for their problem. It might be something suspicious and they need to see a doctor to get into the medical system. And some people are already getting care, but they have doubts. So be careful with being that second opinion. I would go out of my way not to badmouth anyone. I don't know, I wasn't there. But if the patient is having doubts about their care and they're seeking a second opinion from me, then tell them, go ahead, get a second opinion someplace. That's a good time to refer them to a professional clinic setting. The two big problems with these curbside consults is that incomplete information risks misdiagnosis, and then a lack of documentation is a legal headache. Like I said, incomplete information can lead to misdiagnosis. Patients need an assessment, they need an exam, they need to come up with a treatment plan. And if you're not in the clinic, then the information tends to be rushed and limited. If you're not doing a full exam at the curbside, then you don't know what you're missing. The second problem, this lack of documentation, can be a real legal headache. If you don't write things down, nobody knows what happens, and that's why we document things. So have a system for documentation. That was my first book. It's important to write things down. What do you see? What you did, and where you're going with this patient care. Writing it down is part of being a professional. It protects you, it protects the patient, it leads to better care. The two big solutions to these curbside consults is first, rule out red flags, and second, give generalized advice. So ruling out red flags is trying to triage the patient. Do they have a history of major trauma? Is there significant neurological involvement? Are they significantly disabled or in pain? If it's an urgent problem, then they need to get care. The second solution that I would offer is to provide generalized information. We all want to be helpful, but without becoming overly involved. So I have two examples. One is when somebody asks you about their tennis elbow. Tell them it's like a paper cut. So activity-related pain is expected. They need relative rest. They need that disinflammation education. The second example is something like an intermittent painful shoulder. No trauma, full range of motion, no functional limitation. This patient needs pain-free activity. Don't make it worse. But if it persists for weeks and months, then they need to see somebody. If the patient you're talking about sounds serious, then push them to get into care sooner. Stay away from cases you're not truly involved with, but be helpful and be safe. These curbside consults happen to all of us. It's important to know how to handle them. Do you have any good curbside consult stories? Share them with us in the comments below. My two books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. If this video has stirred up your interest, subscribe to stay up to date, or watch one of my other videos right away. Thank you for watching.